welcome to Birth and Bloom. If you're new here, my name is Krista. I'm an international mom of two, a dental hygienist turned midwifery student, and here on my channel, I talk about all things motherhood, midwifery, pregnancy, and childbirth education. So if these things are of interest to you, please follow along and get ready to birth and bloom. Hello, hello, welcome back to my channel. I'm so happy you're here. So today we're going to talk about delayed cord clamping and all things umbilical cord. This is not a brand new topic. It's probably something that you've already heard of as a new mom. You know, you hear about delayed cord clamping, delayed cord clamping, delayed cord clamping. In this video, I want to help just kind of break it down, what it means, and give you the nuance that's surrounding the umbilical cord after birth and when you consider it's the best time for you and your baby to have the cord clamped and cut. Okay, so delayed cord clamping is something that should be routine at your birth. I'm going to give you my perspective and my personal experience per usual. And I've had a hospital birth and a birth center birth with midwives, and there definitely was a difference between the two. Nowadays, in 2024, at least in America, delayed cord clamping is the standard of care for the most part. What does that mean? So let's pretend you are at the finish line, you're getting ready to push your baby out, your baby comes through the birth canal, is born, and comes up onto your abdomen or chest. Okay, so now what? Baby is born. Let's say the baby is doing perfect. They're screaming, they're happy, they are breathing air. What happens? So the baby is attached to the umbilical cord, which is still attached to the placenta, that is still attached to the uterine lining inside of your uterus. So the baby and the umbilical cord and the placenta are a nice little unit. And after the baby is born, the placenta is still inside of you and it's still pumping the placental blood into the baby. It's important to know that the blood that's in the baby and the blood that is in the placenta and the umbilical cord is all of the baby's. The baby has all of that blood and that should all return to the baby. There's no such thing as cord blood. There's no such thing as placental blood. It all belongs to the baby. It's just a matter of if that baby and that umbilical cord is given enough time for that placental blood to travel its way into the baby. So this is what I want to break down for you. So let's pretend baby's born, baby's on your chest, you are blissed out, your baby's born, you're so relieved, and you're so happy that they're here. So when the baby's on your chest, in theory, nothing really should be going on. There may be a little bit of rubbing and stimulation with the nurses or your midwife or your doctor if the baby hasn't let out a good cry. You may see them use little bulb suctions to help remove some of the amniotic fluid that's coming out of their mouth or the nose. That's okay. You know, practices differ from place to place and as far as like where you're giving birth and who you're giving birth with. But baby's on your chest, you're blissed out, you're kind of coming back into your body and you're realizing like, whoa, what just happened? You're a bit, you know, of a deer in headlights at that point. So in most cases, hospitals will practice delayed cord clamping. But what you need to ask your care provider is, what does that really mean for them? Delayed cord clamping in general is waiting 1 full minute after the birth of the baby before clamping and then cutting the cord. And by waiting at least 1 minute, it's allowing more time for that blood to move from the placenta and into your baby. So that's delayed cord clamping. There are different opinions about if that is enough. Is 1 minute enough time for all of the blood to travel to your baby? Maybe, maybe not. In my first birth, I know that I had delayed cord clamping for my baby, but I was in such like the immediate postpartum frazzle that I was so not worried about the cord. I just was glad that my baby was on my chest and was born. So I will be honest with you, I don't remember there being anything discussed of, okay, we're gonna clamp the cord now. I do remember my husband cutting the cord, but I don't remember how much time passed from the birth of my baby to when that cord was actually clamped and then cut by my husband. But I recollect it being delayed cord clamping. I just have no idea how much time actually passed and how much time was given for that blood to come back into my baby. So in most hospital settings, you'll see delayed cord clamping at least at a minute. Generally, a minute to 3 minutes is probably what you're going to hear in the hospital. About at the 2-minute mark, 70% of the placental blood will have transferred into your baby. That's still not all of their blood. Many midwives in the out-of-hospital setting will practice something called optimal cord clamping. What does this mean? It is waiting for the cord to completely stop pulsating. So once your baby is born, because the placenta is still attached to your uterus, it's still pumping that nutrient oxygen-rich blood from the placenta into your baby. And most midwives believe that the cord should be completely untouched, left intact, and most of the time until after the birth of the placenta itself. So many times if you are Googling or on Instagram of looking of home births, you'll see that, for example, if someone had a water birth, their baby has been born, and then you will literally see the cord attached to the baby and attached to the placenta sitting in a floating bowl. And then we can assure that the blood from the placenta has completely transferred into the baby. For my second birth, I gave birth unmedicated in a birth center. And I specifically remember I was waiting for the birth of the placenta, and it had been a couple minutes, and my daughter's umbilical cord was completely white, it was completely flaccid, and it had stopped pulsating. And I vividly remember my midwife asking for permission if it was okay to clamp and cut the cord because it had completely stopped pulsating. So that told us that the blood that was going to transfer into my baby had completely done so, and then that was it. So it's just important to know and kind of know what the nuances of delayed cord clamping are versus optimal cord clamping. And just in general, it's really good to get on the same page with your healthcare provider about what you want. You have to remember that in the hospital setting, there could be multiple other women in labor getting ready to push, and it is a system. You know, they have to keep things moving. So back in the day, they would do something called immediate cord clamping, where the baby was born up on mom's abdomen or chest. They would clamp and cut the cord. And honestly, it's heartbreaking to see these like really, really richly filled umbilical cords where all that blood was just left behind. And that was blood meant to go to the baby. Nowadays, they've realized that, you know, nature intended that blood to come back to the baby. So it may not be, you may not be given the full, 3 to 5 minutes, however long it takes for the cord to completely stop pulsating. But in most hospital settings, your care provider will honor your wishes and at a minimum wait for the 1 minute before they clamp and cut the cord. I want to touch on a couple of things. So delayed cord clamping, like I said, is between 1 and 3 minutes after the birth of the baby. And in most cases, in like a home birth setting or birth center setting, if the baby is in some respiratory distress, if they're not breathing on their own, if they need some resuscitation help, that can all be completed either on the mother's chest or directly next to the mother, and that baby is still attached to the cord until into the placenta. The reason why that's really widely done in the midwifery community is because we know that that oxygen-rich blood is still being pumped from the placenta into the baby. So that baby is still receiving oxygen, though the baby is not breathing on their own yet. In the hospital setting, in most cases, I'm sure, in that case, the baby's cord would be clamped and cut and then brought over to a resuscitation station dealing with whether it's a resuscitation or a meconium aspiration. There's of course some medical emergencies that occur where they would sever the cord and bring the baby to another area to work on. But like I said, in the midwifery model, that baby is generally going to be worked on mom or right next to mom, so the baby can receive that oxygenated blood that's still coming from the placenta. So that's also something to note. Okay, and another thing to touch on, ACOG states that the delayed cord clamping appears to be beneficial for term and preterm infants. In term infants, delayed cord clamping increases the hemoglobin levels at birth and improves iron stores in the first several months of life, which I've read anywhere from 3 to 6 months of life, which has a favorable effect on the developmental outcomes of that baby. So if it makes sense to you, the fact that if you as an adult lost 1/3 of your blood, you probably would not be feeling well. You might be feeling weak. You might feel like you're going to faint. Imagine this tiny little human that you just birthed. This baby deserves to get all of the blood that nature intended. And if at all possible, you should advocate to have the cord completely stop pulsating before it is clamped and cut, for a multitude of reasons. And I'm kind of all over the place with this video. I have a lot of things coming into my mind. Another reason why it makes sense to wait for all of the blood to come from the placenta to the baby is the fact that when the placenta has contracted and moved the blood from the placenta back into the baby, the placenta itself is not as rigid. It's a little bit more deflated because it's not engorged with all of that blood. So that actually helps the birth of the placenta because it has shrunk down. It allows it to shear off the uterine wall easier and allow for a smoother birth of the placenta, which is the 3rd stage of labor. So in my mind, nature doesn't make any mistakes. Back in the day when people were giving birth in caves, they didn't have clamps to cut the cord immediately or to clamp and cut the cord immediately. In some traditions, there's something called a lotus birth where the baby is born, the placenta is born, and they completely stay connected until the cord comes off on its own. So traditionally, there are different cultural beliefs around the world of how to honor the placenta, when the cord should be cut, and all of the things. But in modern 2024, I highly encourage you to do your own research, of course, and decide for yourself if it makes sense for you to wait for the cord to completely stop pulsating before the ceremony of clamping and cutting the cord, because it really is a special moment for your partner or your husband to cut the cord if that's what you want. And then the baby is just, their own little person, and it's a really, really beautiful moment. So I hope this made sense. I was a little all over the place. I apologize, but hopefully you could follow. And yeah, I hope this was helpful. Please make sure to like, share, and subscribe. My Instagram handle is Birth and Bloom. I will put it right here for you. And I look forward to seeing you in the next one. Thank you so much. Bye-bye.